Yes.
Wonderful, wonderful, wonderful. So again, thank you everyone for joining us today. I know you're all extremely busy and taking an hour and a half out of your schedules to just join and come and learn about HRSA programs. It can be daunting, but we hope that today we're able to connect you to many of our programs and resources that can support your institution's recruitment and retention efforts of those students interested in healthcare professions. We also want to share with you and hear from you about best practices and innovative pathway programs for increasing diversity in the healthcare workforce. As TJ said, I am the regional administrator for the Health Resources and Services Administration, specifically the Office of Intergovernmental and External Affairs. And for those of you that are not fully familiar with my agency, the Health Resources and Services Administration, HRSA, we love our acronyms in the federal government. We are one of the 11 operating divisions within the U.S. Department of Health and Human Services. And our mission is to improve health outcomes and address health disparities through access to quality services, a skilled health workforce, and innovative high-value programs. We support more than 90 programs that provide healthcare to people who are geographically isolated, economically or medically challenged. And we do this through grants and cooperative agreements to more than 3,000 awardees, including community and faith-based organizations, colleges and universities, hospitals, state, local, and tribal governments, and private entities. This slide shows you our principal program areas and their respective external facing bureaus and offices within the agency. Today, as TJ said, and Tammy, you're going to hear from the Bureau of Health Workforce about some of their great programs available to academic institutions. Carol Johnson joined HRSA in January 2021 as our administrator. She has outlined 3 main priorities for the agency that aligns with the departmental priorities, and those are workforce, maternal health, and behavioral health. This slide here shows you our organizational structure. I am part of the Office of Intergovernmental and External Affairs, and again, today I'm honored to have my colleague Tammy from the Bureau of Health Workforce join me to share with you some information on key HRSA workforce programs. But before I turn it over to Tammy to talk about the workforce programs, I want to talk briefly about my office, the Office of Intergovernmental and External Affairs, and again, acronyms IEA. We serve as the principal lead on intergovernmental and external affairs, regional operations, and tribal partnerships. There are 10 regional offices spread across the nation with a headquarters office in Rockville, Maryland, and a sub-office in Puerto Rico. I represent the Region 7 Kansas City office, and we serve Iowa, Kansas, Missouri, and Nebraska. My office works across all HRSA program areas to extend the reach of the bureaus and offices to provide that additional touch point for HRSA stakeholders. I tell folks that my office, we do the fun stuff because we don't do the oversight of grants. We just basically go out there and educate partners and stakeholders about the amazing programs that HRSA has to offer. So we serve as HRSA ambassadors, providing outreach and education to increase the reach, impact, and awareness of HRSA programs and resources. And as ambassadors, we can assist you by brokering relationships, connecting you with stakeholders, as well as connecting you to HRSA programs, technical resources, and funding opportunities. And so this slide over here shows you our IEA's core functions. This slide illustrates some of the type of work that we do in the field. And right now, so you know, we are coordinating a few grants one-on-one workshops in targeted rural communities across the region and in Kansas City. So if you would like to receive information about these type of workshops or any kind of webinars that we might be putting together that might be relevant to your institutions, please reach out. You will have my contact information, but this just gives you a flavor of the type of work and the technical assistance that we provide in the field. This is just one slide of where you can find HRSA funding opportunities. And again, this is pretty much the main topic of our discussion during those grants one-on-one workshops. Lastly, this slide over here talks about when you should connect with us. There are many reasons, but here are just few of them. Whether you have questions about HRSA program and resources or need technical assistance, you're looking for funding opportunities to support a project, or you would like to connect to a new stakeholder or partner, or just because you would like to share information with us about how HRSA programs impact your institutions, please connect with us. We want to hear from you. There's no wrong door. We can be the first folks that you can connect with at IEA, and then like for this meeting, we'll just bring the technical experts like Tammy to provide additional information on some of our amazing resources within HRSA. Lastly, this is my contact information. With me today also, it's Maisha Kennedy, and I'm going to ask Maisha to also include her contact information in the chat box so you have another touch point there as well. And with that, I want to just turn it over to Tammy, because the idea was just to give Tammy most of the time for HRSA overview. So Tammy, go ahead, take it away.
Thank you, Nancy. And so I get to talk about fun stuff also. So we have the great pleasure of, in the Health Careers Pipeline branch, of actually administering 4 health careers pipeline grants. Well, 3 grants and 1 cooperative agreement. So I'm going to talk about those 4 programs and move fairly quickly so that you have an opportunity to ask as many questions as you would like to, and of course you'll have access to the slides. So the 4 programs in the Health Careers Pipeline branch are our Centers of Excellence program, or COE, the Health Careers Opportunity Program, HCOP, our Scholarships for Disadvantaged Students program, SDS, and our Area Health Education Centers, AHEC program. And I'll give you an overview of all of those programs. So next slide, please. Thank you. So really the foundation of our programs are to recruit, train, support, and deploy a diverse health professions workforce. That is the foundation of all of our programs. So we are so fortunate that we get to really administer programs that produce health professions, I like to say, like from cradle to grave, right? So we start with really programs like HCOP and COE and AHEC that help develop an interest in even becoming a health professional, right? So we know that one of the keys for our target population, students from underrepresented minority groups and disadvantaged backgrounds, is to plant that seed. Like, this is something that you can do. So we start there with developing an interest. We move to students in high school and GED programs. So step 2 would be graduating from high school and obtaining your diploma and GED, and then moving on to a 2 or 4 year college or certificate program. And then the next step would be earning that degree. And then pursuing any additional training, such as medical school, nursing school, health, any type of health professions degree program or certificate program. And then then the creme de la creme, what we want to happen is that these young people that we are working with, that our programs are working with, find a position and complete the requirements really in working in rural and underserved communities. So we want them to be totally prepared to get their licensure, certifications, and go out to those communities. So our investments for last year, for our SDS program, our appropriation was $53 million. And as you all probably know, we received some increases in our programs for this year. But those are not reflected in this slide because we just received them. COE, we received about $22 million, and we currently have 20 grantees in that program. HCOP, about 15 million. We have 21 grantees, and AHEC, 45 million. Next slide, please. So I'll start by talking about our Centers of Excellence program. And the purpose of that program is to strengthen the national capacity to produce a quality healthcare workforce whose racial and ethnic diversity is representative of the US populations. So we really want to help our grantees produce health professionals that reflect the diversity of the United States. So those grantees work to serve as innovative education resource centers to recruit, train, and retain underrepresented minority students and faculty at health profession schools. They aim to improve clinical education, cultural competence for minority health issues, and social determinants of health, and they facilitate faculty and student research on minority health issues. Next slide, please. So just giving a quick snapshot of our current COE cohort. So our project period for COE just started. We are on a 5-year project period. So we started July 1st, 2022, and we will end June 30th, 2027. And the COE has a cohort of 4 congressionally mandated HBCUs. So we have our regular COE cohort, and they are and I'll go into that a little bit more in subsequent slides. But the HBCUs are Meharry Medical, Meharry Dental, Tuskegee Veterinary Medicine, and Xavier Pharmacy, and they are called out in the legislation. And so they are on a little bit of a different project period. They will start their new project period July 1st, 2023. And as I said before, the funding for 22 was 22.7 million, and each COE received approximately $686,000. The target populations for COE participants are high school seniors, undergraduate students, and students in their health professions degree programs. And currently we have, as I said, 20 COEs, 16 what we call the regular group, and the 4 HBCUs. Next slide, please. So the eligible participants for COE are medical schools, dental schools, pharmacy, schools of veterinary medicine, and graduate programs in mental and behavioral health. Next slide, please. And I just talked about the 4 historically Black colleges and universities. They are legislatively designated. They are named in the legislation. And our regular cohort of COEs consists of Hispanic serving institutions to target Hispanic students, Native American serving institutions, and then those applicants can come in as a combination, what we call other minority serving institutions. So we have thresholds in the notice of funding opportunity for each discipline, and the applicants have to meet those thresholds for the actual recipients, for the students who will participate. So for a school could come in for medicine, and they could combine their Hispanic, African American, and Native American students to form an other COE if they don't have the pure numbers for one of the other groups that are here. Next slide, please. So what do we want these COEs to do, right? This is the bottom line. This is what we want them to build activities around. So we want them to actually help us, form a competitive health professions recruitment and training programs, right? So they have to have activities around that. They have to have clear activities around enhancing the academic performance of URM students so that they are competitive in comparing, actually applying to health professions degree programs, and as importantly, really finishing those programs, right? So it's one thing to get into medical school, it's a totally different thing to graduate from medical school. So they have to put these in place. The unique thing about COE is it has a faculty component. So just like we want the students to be trained, we want the faculty to be trained, because there is a lot of research out there around the importance of having faculty reflect the actual student body and what that does for those underrepresented minority students. So our COEs have to create a faculty recruitment, training, and retention program. The other really important part of COE is the clinical education and cultural competency development. So we want the students training in clinical settings that reflect minority populations in rural and underserved communities. We want URM and minority health disparities research. So that component, the students and the faculty work together to choose areas of research that really reflect the health disparities needs of their community. So if they're in a community with a prevalence of high blood pressure and obesity, those are the kinds of things that the research would center around. And then strategic partnerships with local school districts, community and four-year colleges, and other community-based organizations. Excuse me. Okay. Next slide, please. And none of this work could be done without the partnerships. That is key. And this is just a little bit of an overview of our National Center for Health Workforce Analysis did a 5-year study on our COE program. And these were some of the results of that study, or looking at our data. So, we start again at developing an interest and then finish with really finishing that, the requirements for that health professions degree. So their analysis was over the academic years 2015 through 2020. And over the course of that time, COE trained over 31,000 students, which is quite impressive because we're always working with between 17 and 20 grantees per year. 74% of those were underrepresented minorities, 59% were from disadvantaged backgrounds, and 14% were from rural backgrounds. COE also trained 7,900 faculty, and 92% of those were from URM backgrounds, and then supported student faculty research projects on health issues impacting URM populations. Next slide, please. So now I'll move to our HCOP program, our Health Careers Opportunities Program. And the purpose of HCOP is to assist individuals from economically and educationally disadvantaged backgrounds with entering and graduating from an allied health or health professions program. And of course, the goals are to develop skills needed to successfully compete for, enter and graduate from those programs, improve retention, matriculation, and graduation rates, like COE, by designing these really tailored enrichment programs designed to address the academic and social needs of trainees from disadvantaged backgrounds, provide opportunities for community-based health professions training, and emphasizing experiences in underserved communities. And so if you see a theme developing here, you are correct. Next slide, please. So just a snapshot of our HCOP program. We are in the 5th year of our 5-year project period. So we are in the process of recompeting that program. Follow grants.gov for more information on that. And so for FY22, the funding for HCOP was $15.4 million. And we provided up to about $655,000 per grantee. The target populations are high school juniors and seniors, undergraduate students, both in their early undergraduate career and as they matriculate through undergraduate school. Adult and non-traditional students are included here, and students in their health professions degree programs. And we have 21 grantees right now, which they actually span 9 HHS regions and the District of Columbia. So 15 states and the District of Columbia, which is pretty good for 21 programs. Our eligible programs are, of course, our health professions degree programs, and you can see them here: medicine, dentistry, veterinary medicine, pharmacy, optometry, public health, our allied health programs, 2-year programs, as well as allied health degrees that come out of additional training from 4-year institutions, behavioral and mental health graduate programs, our physician assistance programs, and we can keep going. Next slide, please. And then the requirements for our HCOP programs, and these are so important. These really are the bedrock of our programs. So in order to provide those social, emotional supports that students need, we require that our HCOP programs have a 0.5 FTE for a case manager, someone who is facilitating those programs, making sure that they are in place and they are serving the needs of the students. A data manager and tracker, which also is in charge of kind of that rapid cycle quality improvement of the program itself. Is what we're doing working? We are looking for those recipients to have formalized partnerships, articulation agreements in place with universities and with the community colleges to say, this is a pathway for students to move through and get that degree, right? We have this partnership where you know, with my community college and your medical school, or your 4-year institution, so that we have a clear way for students to get to where they need to go. They have to design activities to support students, and that is everything from test prep to mentoring, to additional academic support in some of those really difficult courses, whatever they find that their students need to complete those programs. And then the recruiting and facilitating entry for that research. One of the things that students lack as they are applying to health professions degree programs is that research foundation. So HCOP aims to strengthen students' portfolios so that they have some things that they may not get in their regular course of study. Next slide, please. So I've talked about this a little bit. I'm not going to spend a lot of time on this slide, but what I didn't really go into a lot of detail about, of course, is the counseling and mentoring and other services. So that has to be provided through the HCOP program. It is a bedrock of that program. The other huge piece of HCOP that isn't talked about as much is the financial aid information. So we all know the high cost of college in general, but really for students from disadvantaged backgrounds, knowing, what it takes to get a medical degree, right? And then helping them plan out what that is going to look like for them. Because the aim of HRSA is to have students go into primary care. But if they are laden with student loan debt after finishing medical school or dental school, which is another story with the amount of debt students come out carrying, then it is very difficult to steer them into primary care. And then I talked about the partnerships. And then we give direct financial support. This is a program for students from disadvantaged backgrounds. So the idea of being able to provide stipends and scholarships is huge, and it is a requirement to help those students with ordinary living expenses as they are going through these programs. Next slide, please. And just a quick snapshot, I'm going to speed up here. Again, we had this same type of study for HCOP, and this just gives you an idea of what the investments were, how many we trained, and what kind of how things panned out for HCOP over a 5-year project, over a 5-year span. So the number of awardees, the number of trainees, and then the percentage of students from disadvantaged backgrounds, and then graduates from that program. So HCOP, again, we have a limited number of grantees, but we have a pretty wide reach. Next slide. So I'll move on to our Scholarships for Disadvantaged Students program. Next slide, please. So the purpose of this program, again, is to increase diversity in the health professions and nursing workforce by providing awards to eligible health profession schools for use in awarding scholarships to students from disadvantaged backgrounds who have a financial need. So the goal, of course, is to increase the number of graduates practicing in primary care, to increase enrollment and retention of full-time students from disadvantaged backgrounds, including students who are from racial and ethnic minority groups, and to increase the number of graduates working in medically underserved communities. So we can keep going. So a snapshot for SDS, the project period, we're right smack in the middle of our SDS project period. So it started July 1st, 2020. It ends June 30th, 2025. There is about $53 million for SDS, and each applicant gets about $650,000 a year. And it is for undergraduate and graduate health profession students. And we currently have 86 grantees in that program. Next slide, please. So the eligible programs, there are a lot of them. And so you can see them here on the screen. Of course, we have our doctoral level health professions programs, nursing, public health, allied health, undergraduate and graduate programs in mental and behavioral health, and RPA programs. Next slide. So the requirement, scholarships must be at least half the cost of annual tuition. The total scholarship cap is $40,000 per student per year, and the SDS recipients must be from disadvantaged backgrounds, enrolled full-time, and demonstrate financial need. And for SDS, this program is a program that really impacts students in a profound way. It is possible to have all 4 years of your health professions degree, maybe not fully paid for, but a huge chunk paid for through this SDS scholarship. So this is a really, really important opportunity for students from disadvantaged backgrounds who meet the criteria and qualify for SDS dollars. Next slide, please. And again, just a little snapshot for SDS. Academic year 2020 through 2021, there were 2,664 students received scholarships and training. 100% of those students met the criteria from disadvantaged backgrounds, and 65% of them were underrepresented minorities. So SDS is hitting its targets there. And then of the participants, of the graduates, here's the breakdown of where they were practicing 1 year post-graduation. Thank you. Next slide, please. So I'll finish up with our AHEC program. Sorry for drinking water. I think I don't normally talk this much. Although maybe my husband would say something different, but the purpose of the HCOP program, of course, is developed and now I'm getting lost as to where I am. Of the AHEC program is to develop and enhance education and training networks within communities, academic institutions, and community-based organizations. So AHEC, or our area health education centers, is actually considered a cooperative agreement. And that is the difference between a grant and a cooperative agreement. Really is a cooperative agreement. HRSA and the AHEC recipients work really hand in hand to develop and enhance programming that reaches the communities we serve. So the goal is to prepare, of course, like all of our programs, culturally competent primary care workforce representatives of the communities served. And AHEC is community focused. That grant is focused on the communities around this country, and then to improve health workforce distribution throughout the nation, particularly among rural and underserved areas and populations, and to develop and maintain a healthcare workforce that is prepared to deliver high quality care in a transforming healthcare delivery system with emphasis on rural and underserved areas and communities. Next slide, please. So just a quick snapshot. Again, AHEC, like COE, is in the first year of a new project period. The target population for AHEC will be your high school students, your undergraduate students, and practicing health professionals. And we have 49 programs, 46 schools of medicine, and 3 schools of nursing in Alaska, Montana, and Idaho. Next slide. So just a little bit about our AHEC model, because it's very unique for all of our programs. So we have an AHEC program office, which is located in one of those entities that I just named. And then we have our AHEC centers. So our AHEC program office partners with centers around the state, right? And so the AHEC program office is where most of the information and dissemination comes from through to the states, to the centers, and the centers work really in their community, right? To administer the AHEC mission. So specialized community-based training, strategic partnerships, rural and underserved populations, practice transformation, interprofessional education and training. All of that is done through the centers. Next slide. We can keep going. So the focus of the AHEC program, we have the AHEC scholars. So of course, everything is based on distribution, diversity, and practice transformation. So The AHEC Scholars Program is a HRSA branded interdisciplinary education and training program. We take students in their health professions degree programs and offer lots of enhancements and different programming and activities that really hone their skills or enhance their skills as they are preparing to go out and practice in rural and underserved communities. We have our core topic areas, and they are here, and they reflect really the values of AHEC, that this is what we want, right? We want our students to have an opportunity to experience interprofessional education. We want behavioral health integrated into the curriculum of all health professions. We want students to understand social determinants of health, develop cultural competency, to look at new and innovative ways of practicing, and to be always current on emerging health issues. And I won't go through all of these, but there is, of course, a pipeline component, the community-based training, huge component. In all of our programs, we are really pushing and promoting that students are being trained in the community, right? They are being trained in these community-based settings. Something unique to AHEC, there is huge investment on continuing education of current practitioners. So the idea that when people are practicing, the AHECs are offering continuing education on all of these core topic areas and emerging topics that come up, as we know from COVID, that you just have to be ready to train people or enhance their training with new and innovative approaches. Next slide. We've also added 2 additional core topic areas in this new project period. So connecting communities and supporting health professionals really aims to increase training and development of community health workers and paraprofessionals. And then visual learning and telehealth to improve virtual learning and telehealth curricula and community-based experiential training. Next slide, please. So again, the eligible applicants, of course, are medical schools, both allopathic and osteopathic, and nursing schools. And nursing schools can apply in states and territories in which there is no school of medicine operating. And I just want to spend a minute on this because the interpretation of this has been different in differing times. So the interpretation used to be that there couldn't be a nursing school, AHEC, in a state where there is a medical school. That is no longer the interpretation. The interpretation now is there can be a nursing school, AHEC, or a nursing school can apply if a state has medical schools that are just not interested in applying. And that takes some collaboration and that takes some talking to each other. But if there's a state where there is a medical school, but that medical school is not interested in applying for the AHEC funding, then a nursing school in that state is eligible to apply. Next slide, please. And again, this is a snapshot of our AHEC program. Again, this was done by our National Center for Health Workforce Analysis, which gives you a snapshot of AHEC over the years 2014 through 2019. And it talks about the kinds of trainings that was done, the disciplines that were represented, just some information on AHEC. Next slide. So I've been talking a lot, but I have a fabulous team of people that make this work possible because as you can see, there's a lot of it. Over these 4 grant programs, I am the branch chief, but I have just a ton. I have all of these wonderful project officers, professionals that are here to help the grantees and just come with a real wealth of knowledge. So if you are interested in more information about the programs, you can certainly reach out to me, but you can also reach out to any of the people on this slide. Thank you so much for your time and your attention. I'm sorry if I went on a little bit too long, but I hope you have a great overview of our programs. I'll turn it back to Nancy.
Actually, I'm going to turn it over to TJ.
All right, thank you so much. So I want to start with asking the room, are there any questions regarding the overview? Do you have any questions for Ms. Rios? Do you have any questions for Ms. Mayo Blake regarding what you've seen today?
Well, TJ, I want to just put Clark on the spot because we have our nurse loan repayment program open. And so Clark, do you want to do a quick plug about it?
Thank you, Nancy. For the nurses, registered nurses, nurse anesthetists, and certified nurse midwives that are currently in practice across the country in the HRSA, the critical shortage facility, that program is open for our Nurse Corps loan repayment program. And we've done some special outreach to our public health nurses, in particular with county health departments and city health departments. We know that these nurses are on the front line and they're often at the lower end of the pay scale. So the loan repayment program would be especially helpful for them. So again, we'll put the links already up. Thanks, Kim. So that's for more information on that program. Please go to the link.